Welcome to Healthy Steps, brought to you by Utica Park Clinic and Hillcrest Healthcare System. I'm Amanda Armstrong. Today, Dr. Harvey Tatum joins us to talk about the importance of colon cancer screening and prevention and deciding what is right for you. Welcome, Dr. Tatum.
Thank you, Amanda. Colon cancer, also known as colorectal cancer or cancer of the large bowel, is the second most common cause of death from cancer in America. It occurs just slightly more frequently in men than women. The colon extends from the anus to the small bowel an average of 4 to 5 feet in length and functions as a storage organ for digestive waste or stool. Colon cancer typically begins with a change in the cells that line the interior of the colon. Like our skin cells, the colon cells constantly are being replaced by our bodies. The normal growth of these tissues is regulated by our DNA. Billions of colon lining cells are made in our lifetime, and errors that occur in cell development are detected and the cells are replaced by our internal repair mechanisms. However, over time, DNA control errors may accumulate and result in abnormal cell growth, which we can see as tissue growths known as polyps. It is felt that most colon cancers develop from polyps, and this process is quite slow for most people, taking 10 years from initially benign polyps to the development of colon cancer. Most colon polyps never cause symptoms, such as bleeding, pain, or change in bowel habits. These are warning signs of a possibly more advanced polyp or cancer, and once colon cancer has developed into a polyp, the malignant cells may spread to the surrounding tissues or distant sites in the body. We know this as metastasis. It's estimated that about 50% of colon cancers develop spontaneously, and about half are related to some inherited risk. A family history of certain cancers, including colon and uterine cancer, may indicate a genetically increased risk for colon cancer. Because there's a long period of time between developing a polyp and change of that polyp into a cancer, this gives us the opportunity to detect and remove growths in this precancerous stage. For this reason, we have seen a steady decline in the rate of Americans developing colon cancer and the rate of colon cancer deaths through colon cancer screening programs. Who is at risk for colon cancer? Approximately 1 in 15 Americans, or 6%, will develop colon cancer, and half of, or 3%, will die of the disease. Nearly all of the cancers begin as polyps known as adenomas or adenomatous polyps. It's rare for colon cancer to be detected before the age of 50 with an average American with no known risk factors for colon cancer. Several factors have been identified which may indicate a risk for early or more frequent development of colon cancers. These high risk factors include family history of colon polyps or cancer, particularly those with more than one first-degree relative, such as a parent, child, or a sibling. Inflammatory bowel disease, such as ulcerative colitis or Crohn's disease. A personal history of precancerous colon polyps, and certain genetic syndromes involving development of multiple cancers in various sites. African American genetic background may be associated with the risk of colon polyps or cancer 5 years earlier compared to other genetic heritage. Symptoms such as blood in the stool, unexpected weight loss, change in bowel habits, or stool appearance are potential warning signs of problems with colon health and should be investigated. Colon cancer screening programs are not intended to evaluate patients with symptoms. Persons at low risk for colon cancer include history of a negative colonoscopy within 10 years, age less than 50 with no identified risk factors. So how can the risk of colon cancer be reduced by screening? Early detection and removal of colon polyps is the goal of colon cancer screening. Removal of precancerous polyps has been shown to improve health outcomes by reducing the risk of subsequent colon cancer. Patients who have negative screening tests are much less likely to have colon cancer in subsequent years. The goal of colon cancer screening programs is to identify patients at high risk for cancer by finding polyps and removing them. In general, the average risk patient with no polyps at colonoscopy may wait 10 years before repeating screening. Negative hemoglobin testing is repeated annually. Negative barium enema and virtual colonoscopy is repeated in 5 years. What are the factors to consider about colon cancer screening? Although colon cancer is a leading cause of cancer death in America, most patients who undergo screening will not have a polyp or die of colon cancer. Not all polyps, in fact, most will never become cancer. Invasive testing such as colonoscopy and sigmoidoscopy may be associated with some discomfort, inconvenience, and cost. The risk of complications causing injuries such as major bleeding, perforation, death associated with endoscopy is very low, estimated to be less than 0.1%. Participating in a regular colon screening program reduces the chance of dying from colon cancer by over 50%. The benefit of negative screening is reassurance of a low risk for colon cancer development for the subsequent years. In general, screening is offered asymptomatic patients in good health until age 80, or as long as there's an expected 10-year life expectancy based on overall health. Excessively frequent screening, screening at an inappropriate young age with no risk factors, or poorly performed screening tests are costly and provide little clinical benefit and increased risk of harm.
Thank you, Dr. Tatum, for sharing that information with us today.
Thank you.
For more information, please visit uticaparkclinic.com.